12th. Let's start out with the roll call.
Supervisor Fiedler?
Present.
Supervisor Counter?
Present.
Supervisor Barkalow?
Present.
Supervisor Roan?
Present.
Supervisor Reese?
Present.
We have a quorum.
All right. The next item on the agenda is approval of minutes. Are there any additions or corrections to those minutes? If not, they will stand as presented. We have public comment. Any public comments? No public comments? All right. We will move on to the business items. My last item is your first item, election of chairperson. So we will take nominations at this point. Supervisor Fiedler?
I'd like to nominate Supervisor Rice.
Okay. Any other nominations?
I'd like to nominate Supervisor Fiedler.
Okay. Fiedler is not eligible. The
cannot be?
county board
I'm
chair is
sorry.
not eligible to
Got it.
serve as a committee chair.
I will withdraw.
All right. All right. Any other nominations? All right. Seeing no other nominations, we will then vote on Supervisor Rice's appointment as chair. All those in favor signify by saying aye.
Aye.
Opposed? All right. Supervisor Rice, the floor is yours.
All right, thank you all. Next item on our business agenda is the election of the vice chair. Is there a nomination for the vice chair? I'm looking to you. Nomination for vice chair.
If I could, can we make a comment besides the nomination or just a nomination? Supervisor Counter was the vice chair last time around. I'm not 110% certain Supervisor Counter is going to be elected chairman of the Community Development Committee in 2 nights. And although if the chairman is here all the time, it's no added burden for Supervisor Counter. But I just wondered if he would like to continue as vice chair, or if perhaps when he looks at other things he's doing, because he's very active in some of the emergency planning things, if perhaps he would decline a nomination, or would he love to have the nomination? I just don't know, Scott, what your overall agenda is.
Well, I would consider it if I have support to the other members. I know that it's very, very rare that the vice chair is, in a committee, is put into a position that they have to do a lot more. I think the majority of it falls on the chair, which, thank you for doing that.
If that's the case, I'd like to nominate Supervisor Counter as vice chair.
Are there any other nominations from the floor? If not, let's call it to a vote. All those in favor say aye.
Aye.
Congratulations, Scott. All right. All right. The next item on the agenda is consideration of establishing a regular meeting schedule. This second, I think this is the second Tuesday of the month, works for me, but how does it work for the rest of you?
Perfectly.
Perfectly? Unless there's any disagreement or discussion, we will consider the second Tuesday of the month at 5 o'clock, our regular meeting time. All right, financial report. I understand Dustin has a report for us.
Thank you, Chair Rice. So you are returning supervisors, but a few of you are new to the admin committee. So we thought we'd maybe just go through a little bit more detail than we normally would on the report. If we kind of start at the Corporation Council. So the typical reports you'll see at the top is the department that you're looking at. And then your columns at the top are your fiscal year, your full year actual 24, 25, and then your prior year through the current month. Your full year operating budget, and then your actuals for year-to-date through the current month, which in this case is March. You take your adopted budget less your year-to-date, that gets your remaining balance, and then your remaining percent is the percent remaining of your full year budget. And then on the left side, we start off with our revenues. We kind of break down by the individual revenues to get to the total. Our wages and fringes, they're totaled up. There's a lot of different things that go into those wages and fringes totals. And then below is the operating expenses broken out by individual accounts. And then at the bottom, you get your total operating expenses, and then your wages and fringes plus your operating expenses are your total expenses. At the very bottom is your report total. We like to see in the black, kind of like roulette. Black is good, red is bad. So if you have more revenues than expenses, you're going to see black. If you have more expenses than revenues, you'll see the red. So for Corporation Council, we're in the black year-to-date at $35,000. Right now, we're looking at reports through March. So we like to see about 75% of the remaining expenses left. They're at 83%, so we're in good shape there. For the administrator accounts, we're in the black. We like to focus on kind of our report total at the bottom first. If we're in good shape. If we're in bad shape, then we like to focus on the individual line items to see what might be causing it. We're in the black here. We got 78% remaining, so we're in good shape for administrator account. The county clerk's office, we're in the black for that, we're in the red for that. So then we look to scroll up, and we see a $32,000 variance for what is dues and licenses. In reviewing this actually with Christine, we found that this should have been in the county boards. This should have been in the county board budget. So we're going to make an entry to correct that. And once we do that, they'll be in the black again. Human resources, they are in the black with about 77% remaining of their expenses. The elections, we're in the red here, but again, we had the election already this year. We have another one this fall too. So we've incurred a lot of the expenses already for that. So as we get throughout the year, we should get closer and closer to reducing that $26,000. The IT department, we're in the red here, but this is normal for the beginning of the year for IT. They incur a lot of subscriptions. If we scroll up a little bit, you'll see our subscriptions, software subscriptions and renewals at $620,000. Total budget was $820, so we've already spent 75% of our budget there. A lot of those are due at the beginning of the year, and they're very high-priced items. Another line item is the managed print IT cost. All the expenses are incurred at the beginning of the year, and throughout the year, John's team will allocate those to the other departments for expenses, so you'll see that amount reduced closer to that $500 budget. The finance departments, we're in the black for the year with 82% of our expenses remaining. The county treasurer, we're in the black with 70%. County treasurer, if you scroll up just one page, this is one of the unique departments where we actually have a negative property tax. So they collect more in revenue than they have expenses for the year. So that gets reallocated to the other departments through a negative property tax. Our self-insurance fund, so this is where our medical and dental costs are. And this one, we kind of look at our insurance premium and claim costs, which for 24 were 10.6 million. 25 was 11.8 million. So we're again, just like everybody else, we're seeing that rising costs. Last year, we had the full year of the reform medicine as well. So we're hoping to start to see that plateau, hopefully. So we can see that benefit of that clinic. The retirement health savings accounts, this is where retirees who have a long-term sick bank balance, if they retire with the county, they will get paid out to a retirement health savings account. Currently, we don't have any property tax allocated to this. We're using fund balance to apply it. And as of 25, when we take that $132,000 that was spent, we have roughly $2.3 million in the fund balance still. So we're going to continue to use that up as people retire rather than allocating new property taxes to it. And then this was actually sunsetted, so any employees hired after, I believe, October of 22, they aren't eligible for a long-term sick bank payout. Our risk and property liability insurance, so this is for our buildings and vehicles. We haven't made, so we're in the red right now, but as you can see from the revenues, we haven't made any entry yet for, I think we typically made that in July, so we haven't made that entry yet. For the revenue for it, that gets split amongst all the departments. And then we just kind of watch our premiums or our claims and premiums throughout the year. Workers' comp, again, another one that we just kind of watch to see the claims. They're 24, 25, we're pretty steady, so hopefully we'll be in that same boat or under again this year. The fleet vehicles, we're currently in the red. I would expect this to stay in the red this year with $5 gas prices coming this summer. This is where the gas, the fuel, and any maintenance items that go for our fleet vehicles. Facilities Department, they are in the black and 77% of their budget remaining. If we go to the admin tax report, this is the other part of the reports. At the top is just kind of our current cash as well as our long and short-term investments. The vehicle registration fees, Robbie's wheel tax, you can see in '24 is when it doubled early in '24. We've been pretty steady ever since. We typically don't pay a lot of close attention to this. What we really like to focus on is the sales tax. As you can see, January was received in March, so we're a couple months behind when we receive it from the state. We usually start the year off slow, kind of ramp up as summer starts. This year's budget is 1.15 million. Last year's was 1.05 million about. And then last year's actual is 1.1 million, so we're hopefully continue to trend in that right direction, increase a little each year. But we like to watch this to make sure we're not seeing decreasing month after month, which could be the sign of a recession coming or something like that. And then the last report in the packet is your KIP report, your capital improvement plan. This was approved in the budget. This is just tracking year-to-date, the expenses incurred for each project, and then the remaining balance to spend. If you see something in the red, that means we went over the budget. Any questions about anything in the report?
Supervisor Counter.
Just on the government expansion, can you expand on, it looks like 444,000 plus? What parts was that zipped it up that much?
Yeah, we actually had the capitalized interest of about almost 2.8, about 3 million almost, which doesn't reflect it on here. So if you added that in, we're still significantly under budget. That's kind of how we had measured it. So, yep.
Rowan.
It was earlier in the presentation, but I think you mentioned a line item where the medical and dental expenses had increased. In my head, it was about 10% using year-over-year numbers. Does that sound about right?
Yeah, it's about that, about $1 million.
Curious if you have a point of view, because we're going to be talking, when we talk about budget, we're going to be talking about year-over-year allocations related to that part of benefits. Curious if you have a point of view on whether 10% is a meaningful data point that we could look at as a reference.
So the 10% is actual cost. So we're a self-funded plan, and so you're going to see spikes up and down every year. It's based upon, people's medical claims during the year. And so a 10% increase doesn't mean that costs were up 10%. It just means claims in that particular year were 10% higher. But I mean, you could see a 10% drop the next year, and you could see a 30% increase the following year after that. So it varies quite a bit. What we do is we rely on our actuaries' projection, and so we take that actuarial average, and that's how we set our premiums. And that's what Leif will talk to you about as we get into that.
Any other questions on the financial report? If not, we're on to the next business item, and that is presentation of the self-fund health insurance. That is Leif.
Leif Larson, come on down.
Thank you, everyone. My name's Leif Larson. I am the benefits analyst for St. Croix County, so I kind of live and breathe the health insurance plan. So Ken had asked me to come and kind of give you a little bit of an overview of our health insurance plan, how it works, as well as kind of what the administration committee's role is as it relates to that health insurance plan. So just to kind of give you guys a little bit of a highlight, currently we have 508 employees covered under the health insurance plan with 1,330 individuals covered. So that would be the full, including spouses and kids. That 508 employees reflects about 86% of our total eligible staff are enrolled in the health plan in some way. And as Ken kind of mentioned, that makes up approximately $11 to $14 million of the annual budget. So it's a pretty sizable portion of the budget. Currently, we offer 2 health plan designs. We offer a traditional or copay style health plan that features copays or cost ceilings for different types of appointments and prescription drugs. And we also offer a high deductible health plan that pairs with a health savings account or HSA. Currently, the enrollment's right about 50-50. We have 47% in the high deductible plan, 53% enrolled in the traditional plan. The way the county approaches that is we set our premium cost the same on both plans. So that helps us with the budgeting perspective, so we don't necessarily have to factor in who's enrolled in what plan. So we set, per the union contract with the sheriff's office, we set the premium to whatever is kind of in that union contract. So this year, we're currently covering 89% of that premium cost. And that is on our lowest cost plan. So on the high deductible plan, we set that to 89%. And then the employees cover the difference on that higher cost or the traditional copay style plan. So you can kind of tell here, based upon kind of what I'm talking about here, is that it really is a key component to our overall compensation package, as well as our retention and recruitment strategies. Every year we do look at not only kind of national averages as far as how our plan compares to nationally, but we also look even at our immediate neighbors, given that, if we're being honest, we recruit from a lot of our neighboring counties. So we want to make sure that our health plan is at least competitive, if not better than a lot of our neighbors, because it is part of that strategy. As far as what you guys as the administration committee's role is, every year you guys will approve the health plan design. So typically in June or July, probably going to be July this year, I, along with Ken, Audrey, bring forward a recommendation. So based upon what our actuaries are saying, this is what we believe our health plan should be based upon a lot of different factors. A lot of it's the actuaries' projections, some of it's your budget priorities. And so we bring that to the administration committee, and ultimately you guys decide what that plan design is. Now, from that plan design, that's going to have a lot of downstream impacts, such as what vendors we choose, what our long-term benefit strategy is, as well as what premiums are. So you guys don't necessarily decide on premiums, you decide on the plan design, which ties to the premiums. So one thing I do want to highlight is before it even gets to you guys, all of our health plan changes go through our health and wellness committee. So this is a focus group of about 31 different staff members across the entire organization. And almost all of the departments or divisions have a representative on this. So during renewal, which is kind of the process that we're in right now, I will go and bring forward different plan design ideas and kind of flush them out with the group before we bring them to you guys for kind of that final approval. Really, they provide a recommendation to the administration team, so Ken, Audrey, and myself, before we come forward and bring those recommendations. So I just want to highlight that there's a lot of vetting that comes through before we get to that formal approval in that July meeting. So I'm going to kind of spend the rest of my time here kind of giving you guys an overview around functionally how does the health plan work. As Ken said, we are a self-funded health plan, which is a little bit different than maybe some of the health insurance plans that you may have been exposed to in the past. So I'm going to kind of start at the top, and then I'm going to kind of work my way down here. When we think about a health insurance plan, there's really 2 different models that are in the healthcare space. One is fully insured, and self-insured is the other one, or self-funded. So what this really boils down to is who's taking on the risk for all of those claims. If you're fully insured, it kind of works like Netflix. So you're going to pay a set amount of premium that the health insurance chooses to give you, and no matter how much you have in claims, how much you have in expenses, you're going to pay that set amount of fees. If you're all watching Netflix, it doesn't matter if you watch 0 or you watch multiple hours of it, you're going to pay that same amount. On the other side is self-funding. This is what the county has. So the way that this works is the county actually takes on all of that risk in claims and expenses. And it kind of works a little bit like an electric bill. There are different ways and levers that we can pull to help reduce those costs. And just like turning off lights when you're not in the room, those costs can go down. Same with a self-insured health plan. So there are, as I say here, a wise consumer will pay less. That, generally speaking, in the long run, a self-insured health plan is going to be more cost efficient than a fully insured plan, because with the fully insured plan, the insurance companies have to have their portion included in that premium for them to keep their lights on and that kind of thing. So with self-insured, we're really just kind of covering ourselves. So specifically how this works, just to kind of give you a kind of a graphical representation, it's money in and money out. So what I like to tell all my new hires is every year when we go through renewal, as Ken said, we rely on our actuaries, but really I want to make a good year from my perspective is that the amount that's coming out in claims, we got the premiums to cover that, and those are equal. And so every year when we go through with the actuaries, that's really ultimately the goal, is to try to get what we expect our claims to be for the next year. Functionally, how it works then is the premiums go in, whether it's the county's premiums or the employee premiums, they go into the health fund, and then out of the health fund is all of our expenses. So these are going to be our medical claims, our pharmacy claims, administration expenses, as well as stop loss. I'll talk a little bit more around what all these different components are, but that's kind of the way the money flows. Specifically around the components, there's really three main self-funded components. The biggest one's going to be claims. That's going to be 75 to 80%. That's just anytime an employee or dependent goes to the doctor, we have to pay that doctor for that respective claim. This is going to be also where we do have the most levers to kind of decrease those costs. The second biggest expense is going to be our fixed expenses or our stop loss. This is going to be, for example, we pay health partners to process all of our claims. I love to say I'm Superman, but I cannot process the claims for 1,300 individuals by myself. So we hire them to kind of just process the claims and make sure everything's working. We also have stop loss insurance, which is based, and I'll talk a little bit more in depth about this, but provides us protection for those catastrophic type claims. I'll talk a little bit more specifics on the next slide, but we've included in the fixed expenses are our premiums for that stop loss coverage. The last component is going to be our claims reserves. As Ken said, every year kind of goes up and down, so we do have to have a certain amount of funds in our reserve to make sure that we are kind of covering those costs for those higher cost claim months and claim years. So just kind of going in specifically on the fixed costs, we talked about the claims. Claims are pretty self-explanatory. I just thought I'd highlight a little bit around some of the fixed costs that are part of the health insurance plan. I really kind of break these down into two separate buckets. One is going to be the administration costs, and the other is going to be our stop loss premiums. Administration costs, as I said, it's the administration of claims. We work with health partners currently. They are who process all of our claims. They're also who negotiate the contracts with the providers. So who can our staff members and families see, because the health partners actually negotiates those contracts with the providers around how much those respective visits and things like that are going to cost. Health Partners also manages our chronic disease management. So for those individuals that have chronic diseases or relatively high cost claimants, they actively manage those cases to make sure that our staff and our families are getting the care that they need and not necessarily duplicating that care. So making sure they're only getting the one MRI instead of the 4 MRIs because they only need the one. The other one I want to highlight here is we have a care advocacy group. We work with a company called Aletheus, and what they do is they help our staff find, I use the term high value providers. So they help our staff find places where they can get certain non-urgent procedures done with a high quality of care, but at a cost-efficient price. So I'll just give an example. You can go at one place here in Hudson, that MRI that you need might be $2,500. But if you go down the street, that exact same MRI might be $900. And so Aletheus does that homework for our staff to kind of route them to those more cost-efficient places. On the other side is going to be our stop loss insurance. And I sort of alluded to this on the last slide, but really what this is this provides us coverage for any of those catastrophic claims. It's both, they call it a specific or an aggregating. Specific means that for each individual, the county will only be responsible for $175,000 worth of claims for that specific individual. A lot of times we'll have a NICU baby, for example. Those claims can run north of $2 million, $3 million, but the county would only be responsible for that $175,000 because of this stop-loss insurance. In addition to that specific deductible, we also have what's called an aggregating deductible. So every year, our stop-loss carrier projects what our claims are supposed to be based upon their actuary's analysis. And if we exceed 120% of those claims expense, stop-loss would cover the claims above that 120%. So again, the aggregate kind of covers everyone, specific covers an individual person. Now, every year, this premium cost is renegotiated, and the way that they look at it is they look at what the claims were in the last year, along with what they expect the claims to be going forward. So they will actually go and look at specific cases, see what the chances are that that person's going to continue to need medical care in the next year, and then that gets factored into the premium that we pay every single year. Next slide. So, and I know Supervisor Rowan kind of mentioned this a little bit sooner, but this is kind of what we're up against here. So to use my term from my high school math teacher, healthcare costs are increasing at an increasing rate, especially here in the last 4 or 5 years. In my past careers, we could count, like 10 years ago, we can count on it being 3% every single year was kind of what medical inflation would be. And that's, just the increasing cost specific to healthcare. However, in the last several years, that amount has drastically increased. So when we're looking at the 2027 renewals, most places are looking at anywhere from a 6 to 10% increase on average. That's just the cost of inflation. On top of that, some employers may be looking at more like a 10 to 12% once you start factoring into claims and things like that. Also, depending upon your claims experience, some employers may even be looking north, as Ken said, of like 30%. To give you guys a little bit of a historical background, the county was looking at a 33% increase a couple of years ago. Thankfully, claims have gone down, but it is something that could happen. As Ken said, it does kind of go up and down. But to kind of give you guys a little bit of perspective, I know you guys just did the coin exercise in the buckets. If we have a 10% increase in health insurance, that's going to take up most of that budget. So in essence, the trick here is that we kind of need to, as Dustin said, kind of flatten that curve as far as our claims. So that way we can use those resources for the other priorities that you guys sort of outline, that you have as a priority. So how do we do that? And so this is a good slide that my broker provides us as far as what are things that we can do to help kind of flatten that curve and minimize that impact of that healthcare inflation. Generally speaking, the more that you move to the right of this chart, the better your renewals are going to be. If you're more on the left, as I said, as you can see that fully insured health plan, you're going to typically have larger renewals. I kind of highlighted a lot of the things that we are doing currently. Ideally, in the next couple of years, we continue to move closer and closer to the right-hand side. The one thing I do want to highlight is that we are doing direct contracts. That's one of the things we're starting to look at with Reform Medicine, which I know Dustin had mentioned that. Next slide. So we work with Reform Medicine. Who they are is they are a direct primary care clinic that is based out of Eau Claire. How are they different than all the rest of the providers that we have? So what we do is we engage directly with Reform, and we have a contract with them to offer primary care services for all of the individuals on our health plan, employees and dependents. The advantage of being a direct primary care is that nothing runs through insurance. So we have a set contracted rate that we have with Reform, and our staff can use any of these different locations that you can see listed here. We have one located right here in the Government Center. It's downstairs between the Sheriff's Office. We also have a location in New Richmond, Baldwin, Menominee. They also have other locations in Lake Hallie and Eau Claire as well. So if our staff have kids or something that are going to Eau Claire, they can access those clinics as well. Really, their business model is working with employers like us. We want to reduce our healthcare spend, and so they work with other employer groups with the idea to get as much costs out of the healthcare system as we can. Generally speaking, healthcare system providers are going to be substantially more expensive. The other thing that is really unique about reform medicine is they're actually open to the public. So you guys as supervisors, even though you aren't on our plan, you guys can go down there as well. They have a clear and transparent cash pay model. So if you go in and walk into that door, they actually have a menu of different things that you can get. If you wanted a doctor's appointment or a different lab, you just go and you can pay the cash price and you can walk out the door. No hidden fees, no bills, no balance billing or anything like that. Direct cash pay and transparency right at the point of service. So just to kind of talk a little bit about what the advantages are of reform. Next slide. So why do we use them? So I kind of like to break this out between both employee and county benefits because we get different things with this relationship. From the employee side, they get unlimited access to nearby, high quality, no cost care. So anybody who is on our health plan can see the doctor free of charge. They also get free labs, free immunizations, and free medications that are anything really that happens inside their four walls is totally free for any individual on our health plan. And it really is patient-focused care. One of the things I like to stress to my new hires is that they approach care differently. So if you go into any one of your system providers, you're going to have a dedicated team of schedulers whose sole job is to make sure that their doctors are scheduled one to the next, to the next, to the next. Because reform is paid differently in the form of a contract, they just take it very differently. And for one, the biggest thing and what a lot of our staff have appreciated is that all of their appointments are 30 minutes. Now, you don't need to necessarily have use the whole 30 minutes, but the time's there if you want to build that relationship and kind of cover all of the things that you need to cover with your doctor. They also offer same and next day appointments. So if you have a sinus infection or you have an ear infection, you can get in and be seen on that very same day at any one of their clinics because they intentionally keep scheduling parts of their schedule open every single day for those acute care. In that off chance that you're not being able to get into your location of choice, you can also be seen at telemedicine as long as any one of their locations is open. So you can connect with an Eau Claire doctor through telemedicine at any point. I know a lot of our staff do this on Saturdays because the Hudson Clinic's only open one day. A lot of them will connect through Eau Claire because Eau Claire's open every single Saturday. Kind of flipping over to the other side, we do offer consistent pricing. I mentioned that we have that contract in place, and that allows us to, have a steady budget. And the goal here is ultimately to get the more care that we can pull out of the system providers, the better off our whole health plan is going to perform. The idea here is I like to think of it kind of like an unlimited cell phone bill, or cell phone, right? The more minutes that you use, the more text messages that you use, the more value you get out of it. Reform's the same way. Because our staff have unlimited access, the more that we can get out of those system providers and into reform, the more money that we are going to save in the long run. Again, also kind of taking a step back, they do focus on prevention. So by building that relationship with their direct primary care provider, the idea is that we're able to address things before they become much larger problems and much larger claims. There's also a lot of an advantage around labs, meds, and immunization. So all of those are passed on to us at wholesale cost, which really is about 10 cents on the dollar as compared to whatever a system provider would give you. So again, not only are we getting them out of the system, but we're also getting the cost savings on the labs as well. And the other real cool thing that our staff have really appreciated is that they do steer to high-value providers. So anytime that you need to seek care outside of Reform Medicine's walls, we have it set up with them that this is the best place to go, not only for you to make sure that you get the care that you need, but also that you get it at a cost-efficient price. And they have dedicated people, they're calling their care advocates, that kind of make sure that that process is as seamless as possible. So, and a lot of our staff have really appreciated that kind of added touch. I'll kind of end with, at the end of last year, we did a benefits survey for all of our staff that we just kind of asked your feedback. And it was a wide range thing on a whole number of different benefits, but the one thing that we did highlight was the clinic, and I asked them a very simple question. Have you used the clinic? If so, would you continue to use it? And over 95% of the staff that have been through the doors at Reform have said that they would continue to use it going forward. And again, I think it speaks to a lot of the patient-focused care that they offer through the clinic. Cool.
Well, thank you, Leif. Are there any questions?
I think it was mentioned during the freshman facilities tour, and maybe you said it earlier in the presentation, what percentage of the total employee count is taking advantage of reform?
We're at about, through 2020, at the end of 2025, we had about 37% of our eligible employees that have been through the front door.
And can I ask, do you have a goal that you want to get to that?
Yeah, Ken says 100. I think it's more realistic to get somewhere in the 60% range. Like I say, we have started a new incentive program to try and get people, more people through the door. That started for all of 2026. We're paying, they're doing annual drawings around getting your annual physical done, as well as just utilizing the clinic.
Thank you.
Any other questions?
Leif, a couple of years ago, when you briefed this initially, you gave some projections about how this would pan out over the next few years. And I understand they can go up and down. But can you kind of refresh our memories to what some of those projections were and where we are in meeting them?
Yep.
Because I know I can't remember the exact year, but if it was the second or third year, you'd hope to be at the break-even point.
Yep.
How are we doing in that?
Good question. So I will say it's hard to monetize that, but where, according to reforms kind of projections, generally speaking, they say you're going to lose money in year one. You typically will see the break-even point sometime in year two, and then you'll start returning ROI in year three. Based upon the calculations, we did do the calculations near the end of year one, and we were right at break even. Again, it depends upon what data set you look at. We were either breaking even or slightly in the red, depending upon how you look at it. I think some of the things that I will caveat that is we've had location challenges through the first year. This picture that you see on the screen here was actually they actually opened up in May, I think it was around Memorial Day of last year. So they weren't actually on site at Hudson and or at full-time capacity until about August of last year. And also this year, they also opened up their Baldwin location, which will benefit us greatly with our highway staff out there as well. So it will be interesting. I will plan to bring numbers probably to in July, based upon kind of taking a snapshot of where we're at there to the admin committee. But that's kind of what I've seen. So according to the way Reform did at the end of last year, we were about 8% up. If you talk to our broker, we were not quite there. We were down, I don't know. I don't remember the percentage offhand. But according to our broker, we were not returning investment at that point. But I would say we're on track as far as what they were projecting us to be.
Anything else? All right. Well, thank you for that presentation.
Cool.
If I
Thank
can
you.
just have Supervisor Rowan and Supervisor Rice move your microphone closer to you when you speak. Apparently, it's not picking up on the audio very well. Thank you.
Will do. How about now? Better? All right. Business agenda item number 6. Audrey, I believe you have this one. Resolution amending personnel policies.
Yeah, and we do have 6 policies to go over. So I'll just give a little breakdown of each one and then pause in between just to see if there's any questions on each one. And then just to do a little background, same as Dustin did, for some of you that are new to the administration committee, just the process of what we do for policy changes. If either it gets brought up at a committee meeting of sorts or an advisory meeting, or I just see a need, sometimes from, seminars or webinars that I attend, different scenarios that come up with employees, we might see a need to make an update to a policy. So typically that starts with the HR department. We will make the changes and then send those changes or recommendations for changes to both Ken and Heather for their review. They will comment on that, and then I'll make any recommended changes that are needed. And then we also take those policy updates to our staff advisory committee. And staff advisory is made up of an array of employees, both supervisory and non-supervisory from across the county. They also comment and have questions about any policy updates. I take into consideration any of the comments that they've made any necessary changes, and then provide the updated policy review. Oh, and yes, sorry, I also send it to all of the department heads so that they're aware and can also make comments or address any concerns that they might have with any updates. And then it goes back to Ken to get added to the admin committee agenda, and then finally it gets presented here. So for the first one, we have overtime and compensatory time policy. So just a couple updates there. We added a minimum compensatory time balance required for the annual payout of 1 hour. We also just updated the timing of the annual payout and added language to allow employees the ability to use the time during the final payroll of the year. So it's just a little bit of a structural change on when that payout is done to match what we currently actually do in practice. Any questions on that one? Okay. Then the next is the breastfeeding support policy. So the policy is being revised to ensure compliance with the federal Providing Urgent Maternal Protections, or PUMP Act. And we just updated the legal references, clarified the break time requirements, expanded our lactation space language to include everything that is required through the Nursing Mothers Act, and added a non-retaliation provision. Overall, there really wasn't any operational changes. It was just the revisions are primarily compliance and clarification in nature on that. Any questions or comments?
Supervisor Connor?
I know when we redid the building here, they added the addition on that we did have lactation support rooms that were set up. Do you know, I wasn't sure, did we do that at the, like the Highway Department facility, and does New Richmond have that and the others also?
All of the locations have a facility or location set up that can be used that meets the qualifications, except for some of the outbuildings. So like Highway, some of the, not the main Baldwin facility. And then the requirements under that are just if there is a request or a need that we would have to make a space available, in which we'd be able to comply with that.
Okay, thank you.
Then the next is the reasonable accommodation policy. So main reason for revision here is just to ensure compliance with the Pregnant Workers Fairness Act. The existing policy addressed ADA accommodations only, but it didn't really reflect the expanded pregnancy accommodation requirements that are now required under federal law. So we added PWFA, or the Pregnant Workers Fairness Act compliance language. We also clarified the distinction between ADA disability and pregnancy-related limitations. And then we also added a pregnancy accommodation section and specify circumstances when documentation may or may not be required. We also expanded examples of reasonable accommodations for pregnant workers and added a non-retaliation provision. So overall, the revisions expanded the accommodation framework to include pregnancy-related limitations as required by the new law on that. Any questions on that? So you'll see a lot of these are compliance-driven or because of changes with laws. So the next one is employee conduct and work rules policy. The main changes there, the policy is updated to align the attendance section of it with recent updates to our PTO and LTSB policies. They clarified the expectations for foreseeable absences, established defined notice requirements, and also added guidance for situations where advance notice was not possible. And so it's really just bringing the three policies all into alignment with each other. Any questions there? Okay. And then we have the drug-free workplace policy. So revisions there to clarify return to work and follow-up testing procedures. This was based off of an incident that happened, and realized that our policy didn't quite touch on what this specific incident happened to need for drug testing. So once again, for post-accident testing, we just clarified that the county may require post-accident testing based on information available at the time. That was specific to kind of this incident that occurred. We're only as good as the information we have at the time, and we have to make our decisions based on that versus maybe specifically what the DOT regulations say. And then also clarified and defined timelines for testing requirements, and we revised the return to work and follow-up testing structure, and then revise the disciplinary language section as well. Any questions on that one? Okay, and the last one, I think, PTO, is the paid time off and long-term sick bank policy. So with that, we revised the policy, basically, you'll see a lot of redlining in this one, but most of it is just reorganization of the policy. So we, just for clarity and ease of usability for the policy, but the new sections, we did create a new standalone section detailing FMLA coordination requirements, as well as collective language regarding collective bargaining agreements and that they control in case of conflict with this policy, and new language clarifying the PTO cash payout option is not available to bargaining unit employees per the bargaining agreement. And then also we added references to the separation from employment policy regarding the PTO and LTSB payouts. Was there any questions on that one? Okay.
All right. Thank you, Audrey. I think at this time, we have attached to this agenda item a resolution amending personnel policies. Can I get a motion?
So moved.
All right. Is there a second? Supervisor Barkalow, second. Is there any more discussion?
I know that Audrey can be exhausting, but this is what happens when we wait 2 months in between meetings. You get all of these policies at once. She's been just storing these up and working on them for the last couple months. So in the future, you'll only see a couple at a time. But yeah, she's pretty much nonstop. She keeps going to trainings and finding out new laws and stuff like that and making us comply with them. So that's what all of these resolutions or policy changes are for in this resolution.
Well, before I call the vote, I just have a question. So, once this passes, how do you go about communicating to staff all of these changes?
So we post it on the bridge, so our internal communication site. We put a posting out on the main page that lets people know, hey, these policies have been updated, and then it links out to those policies to show the revisions of them.
So is there any follow-up requirement that supervisors review this, any training? I was looking at some of the.
Typically not, they're aware of the changes, so it's already gone through department head, so they know that these changes are on the committee agenda for this evening and that they most likely would be approved and will be coming. So they're aware, we go over with department heads a little bit more in depth so that they're more aware of how to manage those policies with their employees. But we don't do specific one-on-one training with employees for each policy update.
Okay. Any more questions? Supervisor Counter?
With all the policy changes that you have in this resolution, is there anything here that, on the county side, that you're not in compliance with or not ready for?
No, we're good on everything.
Need to know that. Thank you.
Are there any more questions, any more discussion? If not, I think we're ready to vote. All those in favor say aye. Aye. Any opposition? Motion carries. All right. Thank you, Audrey. Item number 8, consideration of reclassification. Excuse me, number 7, consideration of reclassification request for highway maintenance specialist to facilities custodian. And that's Audrey again.
Yes. So this is a recommendation to reclassify a highway maintenance specialist to a facilities custodian and transfer the position from highway to facilities. Historically, the position was created within highway to provide some flexibility for backup highway support functions, requiring a CDL of the position so that they could help with hauling, snow removal, equipment assistance, things like that. However, in practice, the position really has functioned almost entirely as a custodial role, really focused on cleaning and basic upkeep of the different highway facilities. So after review by the highway commissioner and facilities director and myself, we determined that the current classification really no longer appropriately matches the work that's being done. And this has created recruitment and retention challenges for that position, right? Employees or applicants who believe they're applying for a highway maintenance specialist role, and then they end up doing mainly custodial duties. So it's just really, and it is misaligned with the compensation structure that way too, right? Looking at equity for roles and responsibilities versus wages. So this position is currently vacant, so we thought it would be a great time to look at a reclassification of it. So there is no impact to an incumbent employee. And by aligning the position with the work that is actually being performed, it is expected to actually generate annual wage savings in the amount of $18,700 because it would be a lower graded position.
I move this resolution of reclassification.
We have a motion. Is there a second? Second, Supervisor Barkalow.
Comment? I attended the transportation meeting earlier in the week that they discussed this in depth. They 100% 5-0 approved it. It sounds very good. I agree with everything Aubrey said, and the Transportation Committee also adopted it.
Wonderful. Supervisor Conner?
Of course, I wasn't at the transportation meeting, but with this in mind and doing this, do we see their potential need then in the future for another highway department operative?
At this time, Robbie said no. I asked that same question, and he said because they rarely used it as backup anyway, they didn't see a need. They were willing to give up that FTE.
Okay.
Any more questions? I have one. Is there an opportunity here for this to be a shared resource with any other buildings in Baldwin?
Well, currently, when the highway maintenance facilities, and Taylor, you can correct me if I am off on this, but was mainly cleaning the Baldwin facility. Now it can be outsourced to all of the highway facilities, so all of the outbuildings as well, this person would be responsible for. So it kind of expands the duties on that. And if needed, under facilities, it's a facilities custodian. So if needed, and we had a special project that needed to be done, we could pull that position out to any of our buildings. They all work under the same job description, so.
Any more questions? All right, if not, I think we are ready for a vote. All those in favor of the resolution before us, say aye.
Aye.
Aye. Any opposition? Motion carries.
Yeah, and reclassification requests are just approved at the committee level, just so you won't, this isn't a resolution, you won't see it at the county board meeting.
Okay.
It does get final approval here with this body.
Yeah, good. All right. Audrey, I think you're up again. Consideration of reclassification request, ADRC Nutrition Program Manager to Volunteer Coordinator.
Okay. So this one is a request to reclassify a .4 FTE from Nutrition Program Manager to a new position called a Volunteer Coordinator, and this is within the ADRC. So really the request was driven by a change in service delivery methods for our ADC Nutrition program. So at the Glenwood City Nutrition Site, it was a restaurant-style meal program, which required a nutrition program manager to be on site. They changed that to a voucher-based model, so we no longer need that nutrition program manager. So they'd like to reallocate that FTE to a different need within the department. They've been asking for and see a need for a volunteer coordinator for the last year or so. And currently, the ADRC relies pretty heavily on volunteers. They utilize approximately 300 volunteers a year, and they service around 14,000 volunteer hours, representing an estimated value of around $500,000 in cost savings. And right now, it's kind of a decentralized model on how those volunteers are picked up and interviewed and what work they're going to do, the background checks, and so everybody just kind of helps. So they'd really like just one position to be able to focus on that and focus on the scheduling. So they just think it would help to centralize that for onboarding and just oversight altogether. So overall, the request is cost neutral. Both the nutrition program manager and the volunteer coordinator position are the same grade level, so there wouldn't be any additional cost. It's just a reallocation of the FTE. That is it.
Do we have a motion to approve Auditor's request for reconsideration of reclassification for ADRC Nutrition Program Manager to Volunteer Coordinator?
I so move.
Oh, go ahead.
All right. We have a motion, Supervisor Rowan, and a second from Supervisor Counter. Any more discussion? I'm not seeing any more questions or discussion. Looks like we're ready to vote. All those in favor say aye. Aye. Any opposition? Motion carries. All right. Next up on the agenda is item number 9, resolution establishing 2027 budget priorities. Ken, that's yours.
Yeah, finally enough of Audrey for tonight. So we went through the exercise at the Committee of the Whole. We heard all the department reports. And so based upon that, I drafted this resolution setting what I think I interpreted to be the priorities of the county board. The way I looked at it then, they came out 1, 2, 3, 4 as employee compensation, health insurance, union contract, and position request. When you look at the amount that was in each bucket, how I would interpret that then is providing compensation increase for the employees. But there probably wasn't enough in that bucket necessarily for a step increase. So what I'd say is it's going to be a minimum of a COLA, and if I have enough, it'll get to a step increase. When I jump to health insurance, the amount in the bucket provided for about a 2.5% to 3.5% increase. And so that sets a goal then for us to reach, which is below the health insurance inflation rate. So that'll probably mean plan design changes to get it down to that level. The union contract, that's either a yes or a no, so that'll be covered. And then the positions. As I looked at the positions, this is the order that I would fund them in, and probably not all of them, but some of them on the list. And then fifth, which really wasn't any of the buckets, but just operational expenses, required operating expenses. You know, if gas goes up to $7 a gallon, we'll pay $7 a gallon for gas because you have to have gas in order to do our job. So these are the priorities, and this is my interpretation of them. So if I'm off on that interpretation, now's your chance to correct and tweak this. If you say, no, that first one, we really wanted a step increase. Step increase is the minimum threshold for us, not the COLA. Or the health insurance, no, we think that should be, 1% higher or something like that. Now's your chance to correct and tweak that, because I use this to build the budget. I follow rules very strictly, so what you say is what I'm going to do, so be careful what you tell me.
Go ahead, Supervisor Rowan.
So related to the first two, to me, those go directly to our ability to attract and retain personnel. And so, is it is it appropriate at this juncture in the discussion to ask the question about, should we come in under COLA and be more of a, I should say, if we should come in under STEP and be more of a COLA approach to compensation, or if it's clear that the pass-through costs to employees on healthcare will be noticeably higher. How should we think about then that effect on our ability to attract and retain talent?
Sounds like you want to hear from Audrey some more.
Yeah, I was slightly concerned by the priorities as they're set out from a retention and attraction. A COLA increase with and so the health insurance at the 2.5 to 3.5, I can tell you right now, we still have a ways to go, but right now they're quoting us at about a 7.7% increase, which we know is too high, right? That's not going to be able to, that'll break the budget. So we will have strategy and plans to try and bring that down. But to get it down to a 2.5%, I think would be very significant plan design changes that would make it so that our plan no longer aligns with other comparable plans. Yeah. Or that the shift of the cost would go to the employee. So either it's such an undesirable plan in order to get down to that rate, or we keep it how it is and shift all of that cost to the employees. And then, that impacts their paycheck, and can they afford that increase? So step increase versus COLA, I want both, honestly, but I think there's benefits to both, right? I think people are so used to step increases. It's anywhere from 1.5% to 2.5% increase, depending on where they are on the wage grid. So I would say that is a typical increase. I don't think it's anything exorbitant. The COLA, though, if we only do step increases every year, what that does to our wage grid is it misaligns us with the market. Our wage grid is built to have COLAs in it every year or every other year at least, in order to keep up with market trends. Otherwise, we end up having to do what we've done like every 5 years. We have to completely redesign the grid. We move the employees all over the place, and it causes a lot of turmoil and tension with the employees. Even if they do get increases, it tends to not go over very well culturally. So I do think that compensation and health insurance, just from a cultural standpoint and an ability to keep the employees we have and attract new employees coming in, especially we have a lot of retirements happening this year, so we're going to be busy hiring, that those should be a priority, just from them.
And what I would say is, based upon the way I have it built right now, we would cover 1, 2, and 3 as I have them laid out at those amounts and percentages. I'd cover probably half those positions, and then I'd run out of money. So if you want more money in 1 and 2, that list on 4 is going to get shorter. That's the impact of the gives and takes.
Did you have a follow-up, Supervisor?
I'm going to play the rookie card here, because it may not be the right place to inject the point. So tell me if it's not. I was thinking back to the exercise that we did with committee as a whole, and reflecting on it based on budgeting exercise that I've done during my corporate career. And I realized that we started in a slightly different place than I've been used to starting when I've done it in corporate. And that is, we assumed at the beginning of that conversation last week that everything we have been doing, we would continue to do. And I guess I'm more used to, at the beginning of budget discussions, having a conversation about if we were to stop doing some things, what would those be, and get them on the table so we can evaluate them against things that we want to do, especially in the situation where the things that we think we want to do, we don't have enough obvious money to do. And so I just wanted to put that out there for some discussion. And again, if it's not the right place in the conversation, so.
Yeah, no, I think your placement in the conversation is great. When I look at our budget, so much of what we do is a mandated service. And that's how can we start with the status quo? Because 90% of everything that we do, you can't change. If you say, well, I don't want to do that anymore, I'd say, tough. State government tells us we're going to do it. We're going to provide foster care resources for children that are in need. I go, there's just not a choice. You can't just say, I'm going to cut that program. Those aren't options. Level of service, you have some control over how well we do it. So, I mean, you can tweak those things, but what we do, very little. I mean, so you could not support the parks. I mean, parks aren't a mandated service. And we provide a list of all the services we do, so you can see what's mandated and what's not mandated. But there's not very much on that list. And so that's how come we don't start usually from that perspective. But if there's ever anything that you identify or any of the other standing committees identify and say, we would like to maybe take a look at this particular thing and maybe do it differently or not do it at all, by all means, we'll look at those and add those to the table. But they just don't come up very often.
Supervisor Fiedler?
Just a quick question. What is the projected COLA?
Well, inflation as of today was 3.8%.
Annualized.
Yep.
So you'd be looking at almost a 4% increase just based on the COLA.
Well, I mean, if you wanted to keep up with inflation, that's what you'd be looking at. We won't have enough money to get to that.
No. I had one more. Just very generally, there's been some degree of I'll just say, discussion concerning the the Justice Support Services and our support for the courts, and particularly our support for those who have addictions and testing for them and treatment for them. And I notice we've got 4 positions in HHS that deal with something or other in HHS, but I know that the courts have been concerned about the fact that they don't have, what in their opinion, sufficient support for those people who are in the criminal justice system. I know, can the administrator comment about how that combination of factors, some of the adjustments that are being made in justice support services and that need of the courts, how that will play out in this budget?
Yeah, the treatment court that's administered by Justice Support Services, the judges have decided that they're going to end that program as of the end of the year. We'll realize probably about $110,000 in savings. A large portion of the program was grant funded, but tax levy support was about $110,000 per year. So that actually will be on the table. And I didn't go into that because $100,000 really isn't that much money in the bigger picture of things. But something like that will come back as that program is wound down at the end of this year.
Even if it's wound down, do you think there's any opportunity at all for HHS to be thinking about or be reconsidering its allocation of staff so that there might be some support for the roughly probably 800 out of 1,200 people that are being supervised in the county have addictions of alcohol or drugs? And I know there used to be a very aggressive HHS service for those people, but it seems like it's diminished over the last few years. Is there any discussion going on about how that might be reconsidered?
Yeah, well, we happen to have Bob Rohr, HHS director, in the audience tonight. Bob, do you have any programs at all to support addictions?
Specifically, those being requested by the judges, not just addictions generally for the population.
Well, first, good evening. First of all, we've placed an emphasis over the last, I'd say, 2 or 3 years on people in the criminal justice system with behavioral health conditions, whether it be mental health or addiction. We don't have a lot of funding for that population, but we've looked at a lot of grants. State Opioid Response Grant, Char Lopez has gotten
at least 2 to 3 grants just recently and has applied for more specifically for that population. Our intention through having, and to add to that, we have a mental health professional or a behavioral health professional in the jail that we funded through opioid settlement dollars, who's been there for, 2 years now? And another therapist in the jail that's only part-time because of the grant funding available. And I think she's there through September unless we can get that extended. So we have a number of efforts underway to further support justice-involved people, and that's only a few of them. The co-responders also respond with law enforcement. The intention there is to prevent people from ending up in jail. But over the last 2 or 3 years, we focused on this population. I've talked to Char Lopez, our deputy director, and said, let's put together a coherent strategy for how to better serve criminal justice-involved people. We don't have the funding, so how do we find that funding and address this population? Part of that strategy was developing what's called the sequential intercept model. It's a structure by which you look at the county as a whole for services that we provide or others provide to this population, and how do we bring those services together into a strategy that makes sense. And she's going to present on that tomorrow night at the HHS board, a broad strategy around this very topic. We also still provide substance use disorder and mental health therapy through our clinic in New Richmond. We haven't stopped doing that. The only difference is that we've hired master's level clinicians who can serve both people with mental health conditions and substance use disorders, so they can provide that same combined therapy in one session as opposed to having that person go to a substance use counselor and then go to a mental health therapist and bounce back and forth. So it's much more efficient. It's clinically more sound to do it that way than it is to have the separation of mental health and addiction. We're aware of, there's several community providers that we refer to for outpatient and residential substance use disorder care. We're lacking in the area of withdrawal management services in this area for people that need to withdraw from a substance before they can stabilize and then go to treatment. But we're currently working with Polk County on a possible solution to that through, I won't get into too much because we're too preliminary in that, but it would potentially lead to a crisis care facility in this area that could help to serve people on a short-term length of stay who needed addiction care and or mental health care. And it could be an option for people that the police encounter to potentially take them there instead of jail, or they're involved to prevent them from being involved in the criminal justice system. Our focus is in this area. I think tomorrow night, Supervisor Fiedler, I think tomorrow night, if you were able to watch the HHS board, you get a more comprehensive view of what all of these strategies look like when they come together.
I want to thank the director of HHS. You do tremendous work personally, and your staff does as well. I do know that there is a lot of concern in the judicial branch about what's happening to the people that come through there. And I might just suggest that you reach out to them, and I think a briefing from you to the 4 judges would just go miles toward giving them an understanding of where you're coming from, get you a better understanding of where they're coming from, and might influence, it won't happen before tomorrow night's meeting, but might influence what you and Shar think about as you progress on this, because it's a huge population of people that at least the courts feel are underserved at this point, and just a good discussion might be helpful.
Yes, sir. Yeah, be happy to do that. Have been engaged with them as much as we can be, but always happy to further engage with them on that. Yeah.
Thank you.
Thank you. Any, done?
Anything else from anyone else here? Go ahead, Supervisor Counter.
Looking at the priorities and how everything is set up, I can see, where it's at, and I can support the things and as you've said it and where we're going with it. A question for you, as we keep forging ahead, do we see, have you looked at what our tempo or our trends are in St. Croix County for both the growth factor, for sales tax revenues and the different things. Do you see that we're setting more level and flat, or do you still see a growth pattern that gives us the opportunity that we can continue to try to stay with what's been happening? Because over the past years, this is always, these are always difficult decisions to make on where we're going with this and ensuring that we're making the most sound decision. Do you see that we're kind of flat, or that we're going to be able to keep up with this?
Yeah, I think it's flattening a little bit, but I think we're going to continue in an upward trajectory. A lot of my peers that I talk to, they're looking at, well, how many positions do we have to cut this year in order to balance the budget? And we're still talking about how many are we going to be able to add? So we're in a much different position than a lot of our peer counties. So we're doing okay, but I mean, it's not an endless stream of revenue. There's a very limited amount. So make wise choices, and that's what this resolution is about.
Supervisor Rowan?
Related to that, actually, I had a question about the sales tax revenue assumptions. So I think when we met last week, you laid out that as a range, 500 to 750, for the purposes of budgeting. And then when we did the exercise, I think understandably you suggested the low end of that range, or just above it at 520. But I did look back at last year's budget, and I didn't look at the actual, so forgive me, but in last year's budget, that number was 1.2 million. And so I guess there is a more conservative view about incremental growth in sales tax 26 to 27 versus 25 to 26. Can you comment on that?
The 5 to 750 is the same number I use every year, same number I'd used last year when we ended up with 1.2. The number I use then for the actual budget is based upon actuarial projections that Forward Analytics gives to us. And so that'll come out in August, September timeframe. So that'll be what I use to finalize the budget. But for priority-based setting, it's better to start with the smaller pot so you don't get overexcited. I can always over-deliver and everyone will be happy, but if I promise you too much and I have to deliver less, then nobody seems to be happy with me. So it's, just a trick I learned over 30 years. So set the priorities, and as more revenues come in, I'll be able to do more things. But if I start off small, it just works better for me.
Go ahead, continue.
Sorry, just to follow up. So I understand that, I appreciate that. I have always had controllers who encourage me to be at the low end of the estimation range. But just to calibrate where we could end up, if as an example, the results for the year were closer to the top of the estimation range, both on the estimation range of sales tax, we're not that far away, I think, from being able to do all the things we want to do, because the gap is, in the 400,000 to 500,000 range, right? So, yeah, I just want to make sure I'm calibrated correctly.
Yeah, so I mean, if we end up with 2 million in revenue and I'm able to do everything and Audrey's happy, then great. But if we're not, what's my priorities? So, and that's really, what this speaks to, is if we don't get the top end of everything, how am I going to utilize the limited resources we have? Where do I start and where can I grow to? So.
Any more questions or discussion? Go ahead.
Thank you for being so patient. Kind of an observation and a question at the same time. An observation, I think just today, or yesterday, the governor and the legislative branch agreed on how to utilize the 1.8 billion surplus in the Wisconsin budget. And in it, among other things, they had, I think, direct payments back to citizens. And it was fairly large. I can't remember the exact number. It was about $700 a person.
$600
$600
per couple, yeah, $300 per person.
Per person. They also had substantial provisions for property tax relief, and they also had substantial provisions for property tax relief as it related to the technical colleges. And all that, I think, was probably a good resolution between the governor and the legislative branch of that. One of the things we've talked about for years now at this committee, at about this time, but I've always posed it as a question to the administrator, if what I'm about to say is wise or stupid. Sometimes he's so diplomatic, he wants to say really stupid. But many times he says, yeah, we can handle that this year. And you know where I'm going with this next one. And that is that all of our constituents would like tax relief. Well, we just mentioned a couple of things where they'll get some tax relief. But here at the county, what I think I can honestly say I've done with Ken's support when we can do it is we've had a provision that looks at our unassigned fund balance. And we take some of that money and we apply it to debt relief, which effectively is an efficient way to have tax reduction. So I think the administrator knows where I'm going with that. Can we do that again? Is this the proper time to do it? Or would you like to come back to us with any options on that?
Yeah, well, that idea is really something we should consider.
The diplomat.
Yeah, probably August, when we know what our unassigned fund balance is and what excess that we're dealing with, that would be the time to address that.
I accept
So,
that.
yes.
And we've had pretty much success with that over the past number of years. Where we've done this, and it's usually been in the vicinity of about $500,000 or more of tax relief. And it doesn't get a lot of publicity because it's, as I say, it goes from unassigned balance to debt relief, but it's really a tax reduction.
Right.
And so I agree with what the administrator said. And he comes back and he says, yeah, we can handle it without risking our conservative budgeting policies, or this is just a bad year, Bob, forget it for now. More or less, that's what he says. Thank you, Mr. Supervisor. Administrator.
Anything else? I just wanted to, Administrator, you want to leave here tonight with a resolution on your priorities. All right. You have to. All right. My only observation about our exercise is we had a lot of new supervisors. I think we're feeling a fair amount of stress on where they put their coins. Some of them had not yet had a committee meeting yet. So they didn't know what they were really voting for. I think specifically the number of HHS things here, it's sort of a question of, well, if we don't fund this, then what? Who benefits or is harmed by the lack of services that these individuals would provide? So presumably that would be answered in the HHS meeting, I think, Bob, tomorrow. That's what they were looking for, is what are the trade-offs?
So we'll approve this resolution setting budget priorities at the June meeting. Department heads will submit their budgets in July. I'll meet with all of the department heads in August and start refining that. In September, we'll go back to all the standing committees and go over all of the budget requests. So in that, we'll go through these positions one by one as we go through the HHS budget and talk about those issues. And they're able to weigh in then and say, you know what, this really is a priority position. You need to figure out a way to get this position in the budget. And then in October, I have to finalize that budget. I come back to the committee of the whole with a balanced budget for you guys, with all of that input put into it. So the budget priorities, while it is really important, it's the first step in many steps to come to a final conclusion. So whether the co-responder is first on the positions or last on the positions, doesn't mean that's the way it's going to end up in October. It just means that that's your viewpoint as of a snapshot of today.
The last observation I'll make, and open it up for any others, is when in my former corporate life, the question of what can we stop doing was always part of employee surveys, and the answers always came back, creating reports that no one reads. So just for what it's worth, that might kind of be out there somewhere. It seems to be a never-ending part of bureaucracy, which is important. Any other questions or comments before we end this? Yes?
I have one more. I would say first time through the process, it feels squishy. It feels like, I can understand we need to give framework guidance, and I believe we'll do that tonight. The part that makes me uncomfortable is the rest of the process, and I take your assurance that there are steps left to go. We're sort of leaving it open for priority one compensation. There's a range here, right? And I think more discussion about determining the criticality of where we need to be to attract and retain employees is critical to that. The other thing I wanted to say on the HHS request, because of the new positions, a lot of them came from HHS. And I think, in my opinion, appropriately so, we've had a conversation about the big unknown about federal funding and its effect on us as a county, on the state, and on us as a county. In fact, one conversation we had was how can we put some money somewhere that cushions against that? And the answer is we can't, really, right? And I get that. But one thing we can do is make sure that the place where the federal budgets are likely to impact the county the most have some way of buffering that anticipated increased load. And I think the positions that have been put forward related to HHS are one way of doing that. And so as we go through the rest of this process, you're probably going to hear that argument from me a bunch, because I think we don't know what we don't know about the trickle-down effect. And funding these positions, I think, is one way of hedging our bet a bit and cushioning the county against what could happen with the federal trickle-down.
Anything else? At this point, we need to provide Ken with some direction. He has provided us with a draft of a resolution. Anyone prepared to make a motion?
I'll move that the resolution prepared by the administrator for our consideration I move that the resolution prepared by the administrator for our consideration of budget priorities be adopted.
Is there a second? Second, Supervisor Counter, I'll acknowledge you. Any more discussion? If not, I think we're prepared to vote. All those in favor say aye.
Aye.
Aye. Any opposition? Motion carries. You have your priorities. All right.
And that'll be on the June County Board, full board meeting on that.
Okay. All right.
June County Board.
All right. Heather, I think you're up next. Agenda item number 10, consideration of updated rules of board supervisors.
Yes.
And I'll just say one thing on the last three items, because I know we've been here for a while. These are introductory items. We're not really looking for a final decision on these. So just know that tonight's not a final version. Specifically 10 and 11, we plan to bring back next month in the format of a resolution and an ordinance. So this is a first review. You'll get a second review next month and then to the July County Board. And then number 12, I've just had it sitting on my list for months now. So I'm introducing it. If you're not ready to take action, it's kind of a big decision. We can delay that one also. So.
Okay. This would be the most interesting part of the night. Just kidding. Okay, so the first, the updated rules of the Board of Supervisors. So in your packet is a complete redraft of the rules. The Wisconsin Counties Association has provided a template. We then put all the specific St. Croix County rules into the template and added some additional items. So I'm just going to go through briefly what some of those additional items are, and then I will go through with you with the next steps. So formatting and spacing is now consistent with Americans with Disability Act requirements. We did add an executive committee to this chapter, and so that's located in section 2.05. The executive committee will have the following responsibilities. They'll serve as the committee that addresses rule of conduct complaints, which I'll go through in detail pursuant to section 5 of the new rules. The executive committee will conduct interviews and provide a recommendation to the full county board regarding selection of a county administrator when there is a vacancy in that position. And also the executive committee will meet with state and local legislators when needed. The executive committee will be made up of the 5 standing committee chairs, the chair of the county board and the vice chair of the county board. Obviously, there is going to be a situation this term where Supervisor Van Sumeren is the chair of transportation and he's also the vice chair of the county board. So he'll just serve that role, but it will only be one position. We won't fill. He does not get to vote twice. And the executive committee will be the committee that will address complaints against supervisors, and I'll go through that new section instead of the ethics code, which we'll discuss next. And I'll explain the differences and why we separated the code of ethics and rules of conduct to make it easier for those who wish to file a complaint. We did also add, as indicated, rules of conduct section, and that's located in 12.2. So the rules of conduct is specific to county board supervisors, where the code of ethics is applicable to not only county board supervisors, but also employees and elected officials. So the rules of conduct that is now set forth in section 2.12 is very specific as to what each board member is required to do as far as code of conduct. So uphold the oath of office, act in the best interest of the county government at all times, refrain from conduct which is offensive or contrary to community values, be responsive to the needs of community. It goes on. So that's one section I would like you to review prior to the next meeting, and let me know if you have any concerns or changes regarding the rules of conduct section. We also added section 4.05, which is the use of cell phones during meetings in order to prevent any possible unintentional violations of open meetings law. It's helpful to have a section that indicates that personal cell phone devices are muted during meetings, and that would prohibit like supervisors from texting each other or having conversations that should be held in open session. And then lastly, the addition of section 5.01 enforcement. And basically that section then incorporates any complaints filed against supervisors regarding rules of conduct, what the procedure would be for the executive committee to address those complaints, and then how they would refer them to the full county board for recommendations. Those recommendations could include a private reprimand, public reprimand, censure, removal, or determination as to whether that board member should be removed for cause. So those are detailed in section 5.01. Beyond that, I did meet with Supervisor Fiedler and Supervisor Rice to go over their changes or additions to the rules. And so there are some things I would like to point out. Specifically, Supervisor Rice had brought up the section regarding virtual appearance at meetings. So I would like the supervisors to discuss this further. Currently, our rules and the rewritten rules indicate that a supervisor could attend a county board meeting or a standing committee meeting 2 times per year per term. So be a total of 4 times in your term of 2 years. And I believe Supervisor Rice can speak to this a little bit further, but to ensure that supervisors are able to attend, even if their work schedule doesn't allow them to be in person, that maybe that should be an unlimited amount of virtual appearances. And there's pros and cons to that. And so that's one item that was brought to my attention. There are a few things that I'll have to change in terms of just, there's a couple typos and a couple things that are not clear. So I will make those changes, such as under the enforcement section, you know, if a member of the executive committee has a conflict of interest or they're the subject of the complaint, obviously they'll have to recuse themselves from sitting in on that executive committee hearing regarding the complaint. So that needs to be added. Some timeframes in section 5 regarding hearings and when those need to be scheduled should be consistent with the code of ethics. So adding a 30-day timeframe in which that hearing needs to be held, that was not set forth in the current proposed draft. So those are some minor changes that I have to make just to make them consistent with the code of ethics. And so we have set timeframes. So things aren't going on for months and months without any determination. Any questions or sections that you would like me to go through further? As I indicated, this is just the first view of this document. If you read through it and you have concerns or changes or questions, feel free to call me and we can meet outside of the committee meeting. But I will make the changes that are necessary and my discussions with Supervisor Fiedler and Supervisor Rice. But I would like the committee, if you would like to engage in a discussion about virtual attendance and whether we should have a number attached to that or not.
I'll just explain my rationale, and that is, first of all, we're adults. The idea of this number like checking attendance seemed, at least to me, kind of silly. We also increasingly are finding ourselves in situations, whether it's weather-related or health-related, where virtual attendance is just something that works for someone. We also have a number of supervisors that work full-time. And so whether it's transportation challenges like the Hudson Bridge or something else, getting here at a certain time is a challenge. So what I proposed was just simply that a particular supervisor would just contact the board chair or committee chair and, ask for permission to attend virtually. And just leave it at that. And then the other changes, I'd want to make sure that, I know Supervisor Fiedler was giving you input, and I'd want to make sure you're comfortable with those changes. They're relatively minor. But earlier today, we passed some rules for our own staff about code of conduct kind of thing, and I think we should bring it upon ourselves as supervisors to exhibit the same kind of respect for each other in meetings and outside. So hopefully this will be embraced by everyone on the Board of Supervisors. So that's it for me, but any other observations or comments? I will say that whatever we decide, it's a long document. What you've created is simpler, but after we read it, I think all of us would be hard-pressed to get like a 90% score if there were a test. So the guidance that I would give all supervisors is have Heather on speed dial. She's helped me several times when I've said, is this okay? Is that okay? Very helpful. Thank you. Anyone else?
I was just going to add, I think Heather did a tremendous job in putting both the code of ethics together and the rules changes. It was very complicated. Heather, you don't have to agree with this if you don't, but I think Heather tried very hard to keep the rules of St. Croix County as they exist today embodied in what we're doing, but there were some things the Wisconsin Counties Association, their model rules, had incorporated that we had not addressed. Is that generally correct?
Correct.
So these really are very similar to what we've been operating under, with the exceptions that you just described.
And I agree with Supervisor Rice that it is a very long document, and there's a lot of items in it, and I don't know how to train on the rules so much as just read them. If you have questions, feel free to reach out, but it is a long document, and it's hard to, remember all the stuff in it. So if there's ever a question that comes up, I have to now memorize the new version, because I have the old version memorized of where the sections are, so, but we'll get there.
Other things? Administrator
Well, I'm just going to ask, Heather's asking for input on your request to go from 2 meetings to unlimited meetings for remote attendance. So before we bring it back next month, would you really like, a nod, a head shake, number of fingers, or whatever, however you want to
paddles.
demonstrate what your preference is so that we can get that in the next version?
Go ahead.
Well, I would simply say I concur in the chairman's recommendation.
As do I.
Supervisor Counter?
Yes, the only concern I have with it, I do concur with it, but the concern I have is just, this was one of the things that was brought up in some of our previous admin meetings in the past, was dealing with ensuring that there's visual contact, that we physically know that that person is there, so that we can ensure that they're participating and listening to what's happening in the meeting. So when we have a voting agenda item issue, that we know that they're informed and they have all the background to make a decision based on the discussion that was going on during the meeting. So it's just, that would be my biggest concern, if we have everybody's doing that we have a method that we can ensure that we have that participation amongst the members, and so they can make the decisions.
So perhaps calling out the clarity that a virtual attendance means camera on.
Now, I will say we've had challenges with that, And part of it is, whether they're at a campground without great Wi-Fi, and the video feed takes up a lot more bandwidth, and they end up getting lags or drops because of that. Just technology challenges. We have struggled with that, and I don't know if requiring it is going to mean compliance or not, but I understand your point. So I'm just cautioning you about, saying, okay, they don't count if you don't see them, that there could be some reasons why they're not able to do that.
And if the supervisors want to review, not right now, but in your spare time, section 4.03, that's the remote attendance at meetings section. And so it does start off by saying board members shall make every attempt to attend county board and committee meetings in person. Obviously, we prefer the in-person, but if you're not able to, it does allow for the remote attendance. Right now, the rules do indicate that the board member shall keep the camera on for the entirety of their attendance. And in speaking with Supervisor Fiedler, we had discussions about, well, what if the meeting's 4.5 hours long and the supervisor needs to use the restroom? Do they leave their camera on, or do they turn it off, use the restroom and come back? So I know that there are concerns, obviously. We don't want cameras in your restrooms, but that is a concern if it's a very long meeting, because if you're here in person, you can obviously get up, leave, go to the restroom, and come back. The last sentence of that section does indicate that supervisors are required to log into the county board portal for voting purposes for county board meetings. I know in speaking with Supervisor Fiedler, you have very small iPads. It might be hard to have two screens on the computer at one time to vote and be on Teams, or you have to toggle back and forth. So there might need to be some education or direction giving to those supervisors that want to appear remotely. Obviously, if the request is made in advance, Administrator Witt or IT Director John Allegro can kind of help the supervisor with those technology issues. But that is how the rule is written right now. I think what I would do, if everybody's agreeable, is just remove the provision indicating that supervisors may appear no more than twice during the first 12 months and twice during the second 12 months. If everybody is agreeable to unlimited, I'll just remove that sentence in the latter part of section 4.03.
This is a very interesting section. As I said, I concur with the chairman's guidance on in what you just described, Heather. We did have kind of a difficult situation, I would just say, about a year ago with regard to the portal voting. And the situation basically was we could see the person on the screen, they could raise their hand, they could say, I voted yes, but they couldn't sign into the portal to vote. And it became a very long, drawn-out affair. And I remember the administrator had to call the person and reaffirm that they had voted that way. And that's another thing. I would just think we could, if we wanted to provide some guidance to the corporate council, we might delete that requirement unless people feel it's really, really important to have them on that second communications device, because we can see the person, we can hear them, and I just don't see any room for shenanigans. So they raise their hand, they say yay, we count it. Just simple. Yeah, or if the voice isn't there, they go up or down. So I think that's just a common sense thing so that we don't somehow preclude one of our supervisors from voting on something they've attended the meeting, they're trying to vote, they just can't do it. So I would just say we need more flexibility in that. If the group concurs, I'd recommend Heather try to build that into the section.
And I could change the language to indicate something such as supervisors shall make efforts to log into the portal for voting purposes, so if they're not able to, then at least it's not a mandatory shall. It's, make all efforts to, if that's acceptable.
Go ahead.
And just a final comment. I have to smile when I say this, but I think it's a serious comment. It deals with section 4.04. That's our order of business. And you might note that there's been one omission from this, and I think the omission comes from Heather trying to follow the recommendation of the Wisconsin Counties Association. But the second item of business, traditionally in this county and this board for years and years and years, maybe forever, has been that we have an invocation prior to the conduct of business. I think if we eliminated that, we would be, violating a lot of tradition that's come through this county and exciting a lot of people about it. And it's something that if we manage properly so that it isn't a lengthy proselytization of one faith or another, but is just a call for our thoughtful consideration of issues and the blessing on the board, I think it's worthwhile keeping the invocation as part of the agenda.
Thank you Supervisor Fiedler for bringing that up, because that was one thing on my notes that are on my desk that I forgot to bring with me. I did remove that just because of best practice recommendations from the Wisconsin Counties Association, considerations about separation of church and state, but obviously you are the policymakers, so you get to decide whether or not invocation remains in there or not. So it's not in here right now, but if you want me to put it back in, obviously that's the direction I will do.
What do others think?
I support that we keep that in.
Anyone else? I feel a little less comfortable with it. It's the separation of church and state, and the length of time. It's really hard to give a preacher a mic and not expect a sermon, and so that factors into my thought process too. I don't know how comfortable we would be with if someone were to profess a faith other than a Christian faith. So what do others think? Go ahead.
Well, I was trying to allude to that in my comment that we need to manage some of these invocations a little better than they have been. I know the clerk, county clerk works with the local group of religious leaders to have a volunteer come before us, and maybe we could work with them a little bit more to address the time that they spend on the invocation, and maybe not, I don't want to say the content, but sometimes we do get a sermon, then we get a prayer. And I think if we dealt with mostly the prayer portion of it, I think it would be less offensive to some. Also, I would just point out that all of our legislative bodies, from the Senate to the House of Representatives to state bodies, regularly have a chaplain who begins the session with a prayer. So even though some folks, like obviously the Wisconsin Counties Association attorneys, raise the issue of church-state, all our legislative bodies have had that for 250 years, so I would not feel uncomfortable with continuing that tradition.
Anyone else? Go ahead, Supervisor Conner.
One thing that we do have in our sheriff's department, I believe, is a chaplain too, or I think we actually have a couple. Going that route might be an alternative too, where they are given if they have the ability to do that as a performance of action, that may be a little bit more neutral and something that's within the services that are already within our county government. That might be another option anyway. With that, then you can give them a little bit more direction about what the expectations are.
Yeah. I'll echo that. I'm personally familiar with one of the lead chaplains there, and has a deft way of handling things, so. All right, we'll keep it in?
Yes, I'll put it back in.
Put it back in, all right. Anything else? All right. Have we concluded direction here on this agenda topic? That was item 10, and item 11, consideration of updated Chapter 90 Code of Ethics.
Yes, so I completely rewrote the Chapter 90 Code of Ethics based on the, I forgot that I have the mouse now. Sorry. Okay, so based on the resolution passed by the county board, I did rewrite the Code of Ethics. It was discovered in this last year that our Code of Ethics was not very user-friendly when you put it into practical effect. So what I did is wrote the Code of Ethics to address those issues that are basically conflicts of interest, unfair persuasion, and political activity. And the conflicts of interest are primarily financial in nature. So the rules of conduct now, so how supervisors behave, how they treat each other, if, don't belittle people, don't swear at people, those types of things, those are now within section 2.12 of the rules of the Board of Supervisors. The Code of Ethics will be utilized for those incidents where either a county board supervisor, a county employee, or an elected official violates a code of ethics, which again, we are set forth in the standards of ethical conduct in section 90.05. So, for example, no official or employee shall use public property, so county property, for their own financial gain. You can't use your position as an employee or official to obtain things of financial gain. So it's mostly, we're differentiating between like a code of conduct and a code of ethics. I did include definitions in there about significant value, a complainant, respondent, financial or economic interest, and those are all definitions right from chapter 19. So in the packet, I did attach Wisconsin statute 19.59, which is the code of ethics for local government officials, employees, and candidates. So a lot of the definitions and language are right from the statute. There are a few things in meeting with Supervisor Fiedler that there's just a couple typo mistakes or clarifications. For instance, there's a section that says if the complainant believes that any board member has a conflict. Obviously, believes is a very gray area, so we want to change that word to either alleges by factual basis that a board member has a conflict. And then specifically, Section 90.07 is the investigations and enforcement procedures. So what we learned in the past 2 years is we did not have a very detailed outline on how investigations and hearings should be handled, including what the burden of proof is, what standard we're trying to meet, timeframes for which things are to happen. And so those are all now set forth in detail in Section 90.07. So example, detailing what a verified complaint means. Most people don't know what a verified complaint. That means that it needs to be notarized, that the person who is making the allegations needs to have their signature notarized, so someone can't falsely submit a complaint under a different name. So that is the starting point. Complaints shall be verified. They have to include the name of the person making the complaint, the allegations of the ethics violation, and then Corp Counsel will review that to make sure it meets all the criteria. If it does, the complaint will be forwarded on to the Ethics Board. As you can see on page 6, I'll try to bring that up here. We added a section that indicates that notice will be sent to the individual by certified mail. That's just to ensure that whether it's a county board supervisor, an employee, or elected official, that they did actually receive a copy of the complaint by sending it via certified mail. There's an additional cost, but it's important that we ensure that the complainant actually, or the respondent, the person against who the complaint is filed, receives a copy of that complaint. There is a section under investigations and powers that I'll be looking into further in speaking with Supervisor Fiedler, but under C4, there's a section that indicates that the Ethics Board could request and obtain from the Department of Revenue, state income tax returns, and other appropriate information regarding the investigation. Before we proceed with approval of that provision, I need to ensure that the Department of Revenue would actually comply with the subpoena from an Ethics Board. So that is one phone call that I do need to make before that provision is included. Under hearings, this is the detailed section that was missing from the previous code, but making sure that the burden of proof is by clear, satisfactory, and convincing evidence, that the Ethics Board shall conduct hearings pursuant to civil procedure, and there's some language changes. We will modify the section to make more clear, but hearings shall be held in closed session unless the respondent requests otherwise. That deliberations are all in closed sessions. Proceedings will be conducted pursuant to Robert's Rules of Order. Parties may make opening statements. They may question each other, present witnesses. All these things were not really detailed in the previous code, and they're important to the practical application of this code and how the hearings should be held. Yes.
Just go forward.
Since Heather's on that particular section now, I think it's 9007 you're talking about, and it's a long description, but if you could go to 9007D 2B, the last sentence.
Is that the basic principles of relevancy, materiality, and probative force shall govern the proof of all questions of fact?
No, the very last sentence of sub B. So it's be 9007 D 2, small b, last sentence.
Sorry.
It reads, in determining if there is a basis for the complaint, the Ethics Board must review the complaint, assuming that every allegation is true. And I simply would raise, does this kind of run afoul of the presumption of innocence of the person against whom the complaint is being made?
Yeah, so actually this did come up in the last Ethics Board, and they, so one of the rules of civil procedure is you take the complaint in the light most favorable to the complainant. That sometimes is confusing to lay people, and so the recommendation was to put it in more layman's terms, that the Ethics Board must review the complaint assuming that every allegation is true, and that's why it's set forth in the probable cause paragraph, not the fact-finding paragraph. The fact-finding paragraph obviously will be based on actual testimony, actual exhibits. So this sentence could be changed if you don't want the Ethics Board to take the complaint in the light most favorable to the complainant, or assuming that every allegation is true. They just need some guidance on what they need to do when they view the initial complaint.
Can I restate that without the two attorneys weighing in? So in the initial hearing, there's two parts. The initial hearing is they determine whether they're going to investigate it or not. In the initial hearing, they assume that the complaint is true, and then they determine whether they're going to hear it. In the hearing, the weight then is shifted that the person making the complaint has to prove it, though. And so that's the two different parts. So initial one, they give more weight to the complainant. And the second one, they make sure that the complainant has to prove it beyond a reasonable doubt then. So that's what they're talking about, though, without all the legal jargon.
I forget sometimes that not everybody understands legalese, and I need to.
I just wanted to raise it for the group to look at before we consider it next month.
And Supervisor Fiedler, do you think that because this is a civil matter instead of a criminal matter, do you think that's appropriate, or do you have other thoughts about whether they should not assume every allegation is true?
Well, to be honest, I would have probably said they should approach it in a neutral manner. So you don't favor either side. It's a complaint's been made. And you were exactly right as you described the second half of the hearing process, that there's a very high standard to be met for finding that there has been a violation. So I don't feel strongly about this. I just wanted to point out that it does favor the complainant up front, and a complainant can basically say anything about anybody, right? There's no limits on what they could accuse somebody of doing. And I just thought maybe this was a bit too overly favorable to the complainant.
And hopefully part of that concern will be alleviated by the initial 9007A, where the Corp Counsel has to review the complaint and make sure that the facts constituting the alleged ethics violation sets forth clearly and in detail. If someone just puts a one-sentence statement about what they think is an ethics violation, I'm probably going to indicate that that doesn't meet the criteria and that their complaint is defective. There's a procedure then they can correct or amend their complaint within 30 days once I inform them that it's defective. But hopefully that initial complaint process that's reviewed by Corp Counsel will alleviate some of those not verified or undetailed complaints. And then just the disposition section. So what will happen is then the Ethics Board would deliberate after the fact-finding hearing. If there's enough evidence to prove by clear, satisfactory, and convincing evidence that the complainant has met its burden, they will then provide a recommendation to the county board as to what should happen. If they believe the evidence doesn't meet that criteria, they'll dismiss the complaint. So depending on who the complaint is against, the recommendations then are set forth on pages 8 and 9. So if it's a county board supervisor, county clerk, treasurer, or surveyor, then the recommendation goes to the county board as to what should be, censure, reprimand, but the county board executive committee would address that. And so it depends on who is the one that's being alleged of the ethical violation. You know, if it's the sheriff or a register of deeds, then a referral or recommendation is made to the governor regarding removal or censuring or sanctioning. So it all depends on which person the complaint is filed against. If it's a county board supervisor, if it's an employee and the employee is to have found to violate the ethics code, then the recommendation goes to the county administrator to determine what should happen to the employee. So it's detailed more so than the old code as to where the recommendations go. But ultimately, the county board, if it's a county board supervisor, the county board is going to make a determination as to what the, sanction should be. So hopefully, it's a little bit confusing, but if it's just addressing a county board supervisor, then it goes back to the county board to address. So Supervisor Counter, do you have a question?
So the way it was previously written, that was a little bit confusing, was when there was an action being taken, that the Corp Council kind of sat on the side of the county to give direction and to listen to that and to do clarification to make sure that what the rules were and where the issues were, and to give direction to the board members on that committee. But also at the same time, the Corp Council was the one that was assigned to listen to the issues of the accused or the person, and have to give advice according to how that was written. That obviously doesn't work very well when you have to sit in both pair of shoes. Has that been, I apologize, that part I was looking for, but I didn't catch, and wondering if that part was changed to address that issue and to clarify who represents who and how that can work out.
It's not very detailed in here, and maybe that's one thing we need to address further. So the only thing it says is under 90.07 D1F, that the proceedings of the hearing will be conducted in accordance with Robert's Rules of Order, managed by the Ethics Committee Chair, and actually that should say Ethics Board Chair, with the Corporation Council acting as a parliamentarian. But you're correct, in this last term, we did have questions come up about how can the Corporation Council both give advice to the Ethics Board, and at the same time, if there's a county board supervisor being accused of something, help that county board supervisor. So it does create a situation where the Corporation Council is kind of pulled in two directions. I can't remember off the top of my head whether or not we put language in here, but I know there was a request before about detailing whether or not the county board supervisor or employee or elected official is allowed to have legal representation outside the Corporation Council, who that should be paid for. That is not in this code as written right now, but if that is a recommendation that we should be more clear of who the Corporation Council is actually providing assistance to, I can add some language to here.
So,
Yeah, and I think we made the determination that if they're acting in their official capacity, we're required to provide legal counsel for them, which would not be our corp counsel then. It would
Correct.
be an outside attorney that we would pay for.
do we have staffing assistant to Corp Counsel where they can be unbiased to be able to?
I don't think you'd be
Situate.
able to use multiple attorneys out of the corp counsel office because the other attorneys report to Heather.
Okay.
So, I mean, you can't have one of the subordinates arguing against the boss. I mean, it wouldn't be fair. So we would probably end up recommending an outside counsel as approved by Corporation Counsel. So, I mean, you can't go out and get, just anybody that you want. We'd have to approve who they're going to be, somebody, that's reasonably priced. Yeah,
Maybe set up an agreement with one of the other counties to have a crossover.
yeah.
So one could represent if that kind of case came up, and vice versa. So you'd have a cooperative agreement.
Yeah, not a bad idea. But yeah, I think if they're acting in their official capacity as determined by Corp Counsel, then we're required to provide legal representation for them.
I have just a few additions that I would have you consider, and I'd like this group's thought. I put this through a screen to say, okay, what are the best practices of other ethics statements and boards? Several, Milwaukee County, Dane County, and City of Milwaukee have financial disclosure requirements on an annual basis where you fill something out and you say, I work for this company and this is where my revenue's from. And I feel myself a little waffly about it because anytime you require something, someone has to do something with it. So then you have to administer it. But there's a lot of conflict of interest language here, but no financial disclosure. And we do sometimes deal with things that someone could potentially have influence over. I'll just use an example that's front and center. If any of us worked for Xcel Energy, we would, we had someone, not vote on something because she owns stock, but if we were an employee there, we'd want to know that, right, as a board. So I don't know what you guys think, or if that's something you want to look at, Heather, before you bring it back. I'm reluctant to throw it out there because it would be an additional administrative task. We'd presumably fill it out on an annual basis, but you'd have to do something with it. So.
What does the county clerk have you fill out now for the auditors? What is that? I thought that was,
I think it's just, isn't it a general, just conflict of interest statement? It's a general statement, acknowledgement.
I remember it's something to do with, do you do business with the county? Does anybody in your family do business with the county?
Yeah.
Something like that.
Could we maybe have her look at that and see if that's encompassing? The other topic that I was thinking of, and it's a little uncomfortable to bring it up, but you can't open a newspaper today without seeing someone in power that harassed someone. There is nothing in here about harassment. And of course, for our own employees, we have policies, but there's nothing that I recall seeing in here about prohibition against harassment. There is something in the Dane County Code that we could look at, but kind of.
Sorry, we're just talking amongst ourselves.
Yeah. Could you look into that? Maybe in the next round, we could look at it. I'm just looking at protecting the county.
Yes, are you talking about like sexual harassment? I think HR Director Haycraft has some info she can provide you.
So as part of the policy, the human resources policies and procedures, we do consider county board members to be employees of the county as well, so that they would fall under the directive of those policies. We did outline several specific policies because we have so many, including our harassment and discrimination, our bullying, our employee work and conduct policy that we did spell out in the orientation documents for the county board members to read and sign off on to say that you understand that those policies are also applicable to you. So those policies may cover in more depth versus having it in two different areas.
I'm comfortable with that then, unless anyone else is. All right.
And if I can just go back to Supervisor Counter's question, I knew I had it in here somewhere, but I couldn't find it. Section 90.04E says assistance of counsel. The corporation counsel shall furnish the ethics board with whatever legal assistance is necessary to carry out its functions. The corporation counsel may retain outside counsel to provide this assistance as necessary. So that's the section I can modify further to indicate that if it is a county board supervisor that is subject to the ethics complaint, that they are entitled to, or employees or elected officials in their official, if their actions were performed within their official capacity, then they will be assigned to legal counsel. And so I can modify that and.
think about law enforcement that get sued for actions that they take. We represent them. I mean, it's no different than that, so.
Okay.
If somebody's acting in their official capacity, we provide the legal services for them.
So unless there's anything else for Heather, I think we've got another agenda item they expect to see on the agenda in a, maybe, is it fair to say final form?
Yes, by the June meeting in the form of an ordinance for this, because this is in the Code of Ordinances. So yes, I will have the final version for your June meeting.
I just want to note, we've been at this for 2 hours. We're almost done with the agenda, but Does anyone feel the need to take a quick break or, all right, let's just carry on then. Agenda item number 12 is Administrator Witt, consideration of authorizing self-funding for auto physical damage insurance.
Yeah, we've been seeing significant increases. It's gone up 103% over the last 5 years. The premiums have gone from 111 to 225,000. So really, I wanted to take a look at, how we're providing for auto physical damage insurance. And now this is just your, if there's hail damage, if we hit another car, the damage to our vehicle, if we're responsible for it. It's not the liability. Liability is a separate policy. So the other vehicle is covered by a completely different policy. So this is just comprehensive in the collision. So we're paying, $250,000 a year for that plan. It has a $25,000 deductible. So, half the time, we don't use it anyways. We just pay for the repairs. But we do have trucks that are worth, $100,000, $300,000. So there are those ones that we can. The big claims that we've had, and, I attached a spreadsheet with very tiny numbers on them that detail every complaint or every claim that we've had. There's a couple of big ones in there that were $500,000 and $300,000 that were hail damage, where we had, 40 to 70 vehicles that ended up with hail damage. That's what's driving it. The statistical average of having hail in Hudson, Wisconsin is 12% per year. So we're good for like the next decade. I know that's not how statistics work. The other thing we've done though, since the big one, since the $500,000 one, we built a garage where we house a lot of our fleet vehicles in. And so, we're doing things differently. Those really large claims shouldn't occur again, but I can't guarantee they're not going to. Now, as we compare our auto physical damage insurance with other insurances, our liability insurance, if we hit another vehicle, we have a $500,000 deductible. Our health insurance, if an employee gets sick or a dependent, it's a $175,000 deductible. We pay the first $175,000. And workers' comp for injured employees, we pay the first $550,000. So we have much larger exposures that we feel comfortable taking on for everything except for auto physical damage. That's really an off-the-shelf product that we're still purchasing. And so my question for you is, are you comfortable changing that and going to either no coverage, because I don't know that I can find a high deductible coverage. My insurance broker told me that's not an option. So it's either no coverage, we're self-insuring it with no stop loss over the top of us, or we continue on with what we are. He said maybe he could get our deductible up to $50,000, but I just don't know that the premium savings is probably going to be worthwhile at that. So that's what this is about. You just have to know, though, that we have 269 vehicles that we insure, $18 million in value. Tornado comes by, blows away the highway shop. That's a lot of money that we just made a bad mistake on that would have been covered by this policy otherwise. So, but the odds of that are very slim.
All right, what does this group think?
And again, this is a big financial question, so I do want to give you guys time to think about it. There's not a rush. The policy's not up until November, so we have plenty of time to talk about it. But I want to at least get it on your radar so that you guys can take some time and think.
What was the savings if we went to self-insurance?
I think it's break even on the average year. So the issue always is, and the reason I think we self-insure for like health insurance and stuff is because we're taking out the profit incentive for the insurance company. I don't think there's any insurance brokers on our board here. They're all making a profit though. And so if we eliminate their profit, that's savings for us. So on the average year, nothing. But we have some years where we had, $10,000 in claims. We only ran over one deer that year. Most of these are running over deer, bears, and turkeys. That's where most of our claims come from. Yeah, bears. We run over bears. It's on the list. So I mean, that's where, you know, a lot of the claims come from, but it can be low, it can be high. I think our lowest year was like $10,000 and our highest year was like $800,000. The average though is right around the premium that they're charging us right now. I'm just saying though, the average is skewed because of those two hailstorms for 500 and 300,000. If you eliminated those, we would be down to about 150,000 a year as an average.
Supervisor Counter?
I'm not sure where it ends up getting covered, but two things, like when the sheriff's deputies have to do a maneuver to pull a vehicle off and they do damage to a vehicle, that would be considered most likely comprehensive. They're the ones doing the action. And then the other one is, what do we do in the case, we've had a couple of times where we've lost some really expensive plow trucks from people that are not being careful, trying to maneuver around them and stuff, and having a loss that goes beyond what the statutory requirements for insurance coverage, and who covers the excess loss and how that works.
So here on January 9th, there was a pit maneuver to pin a vehicle. We sustained just under $16,000 in damage, and we can recoup that through restitution. We actually charge the other person to get our money back. A lot of times they don't have money to pay us, but that's restitution available. And the damage to their vehicle is not covered. We're not responsible for that because they were doing something illegal at the time. So a plow slid off the ice and into a postal van, so there was damage to the postal van. So we'll have to pay for that. That's our liability policy, though. That's a separate policy. The cost of the damage to our vehicle, though, would be this policy. And so those are where the differences are. So other vehicles, when we're liable, are covered by our liability insurance. We have a $500,000 deductible, and then our insurance covers up to $15 million after that, so we're good.
What do others think?
Well, obviously, the administrator brought it to us with the idea that it was a cost savings, and I think he's made a pretty good case.
I would agree.
Yeah, cost savings, but I do want to caution you, there's an upside risk. Just like when we talked about the health insurance, well, this year was, you know, $1 million higher than the prior year. You're going to have the same thing with here. And you can see the last 5 years. I've kept track of every single claim that we've had. So you can see the high years and the low years. You just have to be comfortable with knowing that we're going to pay those.
Yeah. So if we were to give you the green light on this, would you then put some money in reserves for the inevitable expenses?
Yeah, I think, well, we have the insurance fund right now where we run our liability insurance, property insurance, which is a separate policy that we have, and then auto policy through. All three of those insurances are within this insurance fund, the 1540 cost center. That fund has about a $4 million balance right now. So I think the balance is fine. We don't have to set aside any more money. But what we are paying for premiums, I would put into that fund every year. So that's how I would cover it. And then that should cover the ups and downs as we go forward.
Would you like to come back next month with a dollar amount and a resolution for us to consider, or do you want a decision tonight?
No, it's just a budgetary change, and you'll actually see almost no impact. It's just, I won't renew the policy when it expires in November, and I'll go with an alternate self-insured plan if that's what this board approves.
Anything else? I used to work for an insurance company. The one rule was always, you only insure for catastrophic loss that you can't cover yourself. This looks like something we can cover ourselves.
Right.
So I would be comfortable with attempting to self-insure for this, but then have you periodically include that as part of your reports. You know, perhaps every 6 months, so we can kind of see how it's tracking.
Yep. List on November 13th, 2025, when we struck a bear.
Yeah. Yeah, I like the goose on the windshield myself, but
Yeah, he sent me an email saying he goosed something.
all right. Do you need anything else from us?
Yeah, so if this is something that you're comfortable approving tonight, you can by all means approve it tonight. If you wanted another month to sleep on it, then I'm comfortable with that also.
Do you need a resolution from us?
It's not a resolution. The administration committee is authorized to make changes in insurance plans, and this is a change to our insurance
Are we comfortable?
plan.
Yep. All right. That concludes agenda item number 2.
Oh, you're gonna have to make a motion, a second, and vote on it then, if that's what you want.
Oh, all right.
So I wanted to record it in the minutes that you guys said I could do this, so.
I'll entertain a motion. Yep.
Motion to approve self-insurance on our automobiles.
Motion Supervisor Barkalow, is there a second? Seconds. Supervisor Fiedler, any more discussion? Looks like we're ready for a vote. All those in favor say aye. Aye. Any opposition? You have your decision. All right, request for future agenda items.
I think next month Dustin's gonna try to bring Ellers in. I think it'd be available on that second Tuesday.
Correct, yes, he is.
So just like we did with the health insurance tonight, where we gave you a little bit of an educational background, we're going to try to do that with a few more things. Our insurance, our investments, so that you guys can get some knowledge built up to start this term off and understand some of the decision-making that this committee is charged with.
Okay, good. Anything else? Nothing? Any announcements? Some side discussion? Was there another agenda topic or?
Maybe, I'll bring that to you if we
All
can
right.
get that finalized.
All right. Date of the next meeting? I don't have my calendar in front of me. It's June 9th. Is there anything else, or are we ready to adjourn? Entertain a motion to adjourn?
You could just announce it.
It's 7:21, and I declare we are adjourned. Thank you.
That's an interesting thing.
He said June.
Declare that we're adjourned.
We're done.